I want to welcome everybody and thank you for coming. After our months and months of planning, it is really a treat to see everyone who's here in the room. And I want to thank all the people who are listening and watching online as well. I am Faith Mitchell, President and CEO of Grantmakers in Health, the professional association that supports and informs the work of health philanthropy. And I'm really pleased that you can join us for this funders meeting on a healthy America. It's not news to anybody in the room that the U.S. lags significantly behind other developed countries in the health of its people, and everybody that's around the table is working to change that in some way. Today you're going to hear about a new initiative that aims to create a movement for health in the United States by using media platforms and working across sectors to change the national conversation from what's happening to individuals to the health of communities and the health of our nation as a whole. At Grantmakers in Health, we're excited about this initiative because it provides opportunities for foundations and organizations of every size and geographic scope to play a part in a movement that aims to reach deeply into communities. Because a Healthy America will be active both locally and nationally, and will engage numerous public and private funders, it has the potential to multiply the value of foundation investments many times over. So the goal of today's meeting is to describe the A Healthy America initiative and to discuss roles that funders can play to support it in their communities. During the question period and even after the meeting, when we plan to send a short follow-up survey and have other follow-up activities, we encourage you to share your ideas and experiences as they relate to the goals of a healthy America and to think about how your foundation's priorities could contribute to this long-term effort. So I want to give you a quick overview of the agenda. We're going to go around the room in a minute to give everyone who's here a chance to introduce themselves, and we'll also on the screen we'll have the names of the people who are listening remotely. Then after the quick introductions, you'll hear from Harvey Feinberg, President of the Institute of Medicine, and John Hoffman, television producer and founder and CEO of the Public Good Projects. Then they'll be followed by a panel of speakers from the Department of Health and Human Services and private foundations. After the presentations, you'll have a chance to ask questions, and the online audience can submit questions too that I'll read and present to the presenters. And we have some presenters in the room and then some who will be on the screen, as you'll see. So couple logistical things. If you're sitting around the table, be sure to use the mic when you introduce yourself or if you ask a question. And then there will also be a wireless mic for anybody who's sitting around the edge. So let's start. I'll start at my left with Kaya, and go around, just introduce just your name and your affiliation, please.
I'm Kaya Lewis, and I'm with the Department of Health and Human Services.
I'm Susanna Fox, and I work at the Pew Research Center.
I'm Alexandra Drain, and I work with Eliza Corporation and Engage with Grace.
David Fukuzawa, the Kresge Foundation.
I'm Linda Cornish with Seafood Nutrition Partnership.
Beth Ruoff with Ogilvy Public Relations and a consultant doing communications for social marketing.
John Barden from the Public Good Projects.
And Allie Moss, also from the Public Good Projects.
Claire Flanagan with the Institute of Medicine.
Chris Kohler with the Milbank Memorial Fund.
Rose Martinez with the Institute of Medicine.
And Morgan Heller, also from the Institute of Medicine.
Kim Elliott with the Robert Wood Johnson Foundation.
I'm Robin Hogan with the Robert Wood Johnson Foundation. As I realized when I walked in the room, I raised the average age by 10 years, I think.
Ellen Wartella, I'm faculty at Northwestern and a member of the board of the Public Good Projects.
Patricia Matthews, Northern Virginia Health Foundation.
Olivia Flato, a Pershing Square Foundation and member of the board of the Public Good Projects.
Julian Seeley, Clinton Health Matters Initiative.
I'm Victor Kaposha. I'm on the board of the Public Good Project, and I'm here to support Robin in raising the age.
I'm Mitch Bach with the Mount Sinai Healthcare Foundation in Cleveland. I'm Unique Redwood with the Consumer Health Foundation here in Washington, D.C.
I'm Megan Matthews with the Michael and Susan Dale Foundation.
John Hoffman with the Public Good Project.
And I'm Harvey Feinberg at the Institute of Medicine.
With Grantmakers in Health. Allison Prensevich with Grantmakers in Health.
Clyde Bainey from the Institute of Medicine.
Cassidy Smith with the Colorado Health Foundation.
Taryn Fort with the Colorado Health Foundation.
And Celeste James with Kaiser Permanente.
We have some room around the table, so please join us here. Harvey, we turn things over.